Okay, our next one is 7273.
Super. Thank you, ma'am.
Hey, this is Ron Steele over at KWWL. How are you guys doing today?
Good, Ron, good, Ron.
Hello, Ron Steele, Chris Earl here. Happy Friday.
Thank you so much.
All right, next one is 0233.
Yes, that's David Pitt with the Associated Press.
Thanks, David.
Hey, Kay, are you at 3731? Kay, are you at 3731? No. But yeah, no, she is. She is. Have it on her. Yeah, 3731.
Yes.
Great.
Yes. Yes. Damn it, what is it not doing it?
We got you, Kay. Thank you.
We got you. You're good.
Thanks. I am on my spot right there. Okay, very good. Cool.
They are up on the satellite too, by the way.
All right, they're all.
If you're going to be asking questions, you either got to talk loud or sit a little closer to some of these mics. So just FYI.
Thank you.
No problem.
What?
Two side mics,
I,
this one.
yeah. I might go to that one.
You see the computer again? Yeah, super, thank you. I just wanted to make sure that you were plugged back in.
Hi. Yeah, no, I went like the back way. Yeah, it's, yeah. Yeah, like I passed the weather service on Northwest.
Nice job. See if you can zoom in
Yeah,
on that one.
took me local, I don't know.
There we go.
Okay.
So everyone had that one yesterday.
Okay, I got here, so that's all that matters. See you soon, bye.
3 minutes.
Barbara Rodriguez?
Hey Barbara, can you just confirm your number? Are you calling it 1212? Barbara, are you at 1212? Okay, we'll figure this out. Yeah. I wish it wasn't like.
Minute and a half.
I'm here.
Barbara, can you hear me okay? Barbara.
Okay. That's good.
Hey, if anyone, Barbara, you don't hear anything right now?
The curve on this today is about
30
13%.
seconds.
No new deaths are
They're saying they can't hear us at all. Can you hear us at all, guys? Anyone?
It also reports 80 people currently hospitalized, 415 never hospitalized, coming amid a very tragic day, especially in New York State. Nationally,
Barbara, can you hear me now?
51,000 confirmed cases.
I can.
26,000 deaths. And in New York
There's
State,
someone else who's not muted right now.
We're gonna mute all the lines
Still
right
waiting
now.
on the governor, whereas the
She's
major
not
component
in
from
here.
yesterday was extending the emergency
Yeah.
through April 30th, meaning that non-essential businesses are still closed for the month of April. Schools not to look back in until at least the end of April. Now walking.
Okay. Well, good afternoon. We'll start as normal with an update on the numbers from earlier this morning. Today we had 85 new positive cases in 3 new counties for a total of 699 positive cases in 65 counties. We had 710 negative cases today with a total of 8,764 negative cases. Total tests available at the State Hygienic Lab is 2,500. We have 80 Iowans hospitalized as of last evening. We have 188 recovered, and today we have no new deaths. Every day, my office receives hundreds of calls and emails from Iowans looking for answers about what's happening with our COVID-19 mitigation efforts, how we are making decisions, and what it means for their families. Today, I'd like to address some of the top issues that are on the minds of Iowans. At yesterday's press conference, we shared additional information about the metrics that we have been using to assess and guide our COVID-19 mitigation efforts here in Iowa. And many Iowans, they wanted to know more about the metrics and who put them together and really what was involved in that. The metrics were developed by Dr. Badati, who is in daily consultation with her team of epidemiologists in Iowa Department of Public Health Center for Acute Disease, epidemiology, and other experts in Iowa and across the country. These experts include local public health administrators and their teams, local emergency managers, clinical personnel, and EMS providers. She also consults with the Iowa Infectious Disease Advisory Council, which includes physicians and experts from across Iowa, including a number of infectious disease and emergency medicine physicians. Dr. Badati also participates in weekly calls with state epidemiologists from across the country, and the CDC's Incident Command Team. And I want to say how very fortunate we are to have the expertise of Dr. Padati and her entire team. So I just again want to say thank you to you and your team for all that you're doing for Iowans. People have also asked questions about Iowa's regional map that we shared yesterday, how it was created, and why Lynn and Johnson counties are in different regions, and why we look at the state from a regional perspective. So I would like to invite Sarah Reister to provide information on this topic.
Thank you, Governor Reynolds. So the events of September 2001 included attacks on the World Trade Center and anthrax attacks in the United States. And that led to the establishment of a federal public health preparedness program and hospital preparedness program. These federal preparedness programs provide funding to states to support public health and hospital planning efforts for public health emergencies. The Iowa Department of Public Health has been the lead agency for the administration of these federal preparedness funds. Over half of the funding received to support these federal initiatives is given to local public health agencies and hospitals to support planning efforts. This funding is also used to support the State Hygienic Laboratory. For years, public health, hospitals, laboratories, emergency medical services providers, and county emergency management officials have engaged in this work together. These sorts of planning activities include regular exercises that test the healthcare system's capacity to move patients and equipment in the event a particular hospital becomes overwhelmed. The regional map displayed on the screen during the press conference yesterday and today is the Regional Medical Coordination Center map, which mirrors the Healthcare Coalition service areas that were developed by the Iowa Department of Public Health in 2016 to strengthen regional coordination for responding to disasters such as the one we are currently experiencing. The Regional Medical Coordination Center map is data-driven and based on information that tells the story of where patients in different parts of our state go to receive care when they are experiencing a health emergency, such as a traumatic injury, a heart attack, a stroke, or acute infectious disease like COVID-19. Partners that have participated in planning with the Iowa Department of Public Health for these events include local public health agencies, hospitals, emergency medical services providers, and county emergency managers. When the Healthcare Coalition Service Area Map was developed by the Iowa Department of Public Health's Bureau of Emergency and Trauma Services, patient flow data showed a distinct pattern of patients from southeast Iowa moving to hospitals in Johnson County when necessary acute health care is not available locally. And another distinct pattern showed patients in northeast Iowa being hospitalized in Blackhawk and Lynn counties when those patients need a higher level of care. The Regional Healthcare Coalition Service Area structure is used for planning purposes and does not limit the ability and need for neighboring counties to continue to coordinate as necessary to provide the appropriate level of care for Iowans. So at this particular point in time, we have the regional medical care or coordination centers have been stood up in all 6 areas, but the first ones have been Region 1, Region 5, and Region 6. So Region 1 is the South Central region on the map, and we have information within the region, such as the number of ventilators that are available, the number of patients that are hospitalized, the number of patients that are in the ICU in each of these various regions, as well as the number of beds that are available. We have the same information for Region 5, which includes Johnson County, as well as Region 6, which includes Lynn County. So with that, Governor, I'll turn it back to you.
Thanks, Sarah. Iowans are also watching news coverage about the healthcare surge in other states, and they want reassurance that our hospitals are ready and equipped to provide care for Iowa's cases as Iowa's cases are rising. Dr. Padati, I think you're the best person to address this concern.
Sure. So I think, again, something that's important to keep in mind overall when we think about this virus and what we know so far and how we integrate that into prior lessons and prior responses. Still, a majority of what we see are that about 80% of cases have milder illness and about 20% are going to have more severe illness. And it's those people who have more severe illness that need higher care. And so we've learned that people who are older or people who have underlying conditions like heart disease or breathing problems are people who we want to particularly be concerned about. And for a while now, we've been recommending that those people, as well as everybody else, stay home as much as they possibly can. And it's particularly important for those people who are older and who have underlying conditions, because those are our vulnerable populations that we're really trying to protect when we think about this virus. So we want to keep those persons healthy, and we also want to make sure that we're freeing up the time and expertise of our healthcare workers and healthcare facilities to help care for Iowans who need it. And as we've mentioned before, and as you heard from Deputy Director Reister, the kind of work that we do to prepare healthcare providers, healthcare facilities, and public health is work that has been going on for a long time. And we continue to integrate new information and take new approaches from the local level, from partners that we hear from here, from our neighboring states, from our federal experts, and from the experience of others in the world to help us make those systems better every day so that we're equipped to respond to and care for Iowans. And again, all Iowans have a role to play in this response. We want to encourage everybody to stay up to date, stay engaged with public health, practice those good personal health measures of washing your hands, covering your cough, and staying home as much as possible. And in doing so, we can all protect our most vulnerable population and preserve our healthcare workforce.
Thank you, Dr. Pinotti. And finally, I want to directly address the issue of shelter in place. So Iowans of all walks of life are either strongly in favor or strongly opposed to sheltering in place. And this has become a divisive issue at a time when we must be united in our response to this crisis. I want Iowans to understand that we have taken significant and incremental steps to mitigate the spread of the virus since we identified our first case in Iowa on March 8th. We were ahead of many states in our response efforts, and we continue to dial up our mitigation efforts, again, based on data that was presented from the experts in the Iowa Department of Public Health. I signed a proclamation of disaster emergency on March 8th and fully activated the State Emergency Operations Center, or SEOC. And in the days and weeks since, signed a proclamation on March 15th recommending Iowa schools close for 4 weeks, for which they all did. On March 17th, I ordered business closings, including restaurants and bars, and restricted mass gatherings and social gatherings to 10 people or less. On March 22nd, I ordered additional businesses, including salons and barbershops, close. On March 26th, I ordered all non-essential and elective surgical, dental, and orthodontic procedures and closed several types of additional retail stores and businesses. Yesterday, I ordered school closures through April 30th and extended all existing business closures or existing service suspensions, all regulatory relief and restrictions of mass gatherings to 10 people through April 30th. So if you did a side-by-side comparison of what we are doing in Iowa and what other states are doing, they are much the same. Even those states that have implemented shelter-in-place orders have kept the majority of their businesses open, similar to our orders. As we continue to evaluate our data and make the recommendations of the Department of Public Health and the CDC, if additional action is necessary to protect the health and safety of Iowans, I will do so. But again, it will be based on data and metrics that are provided to me by the experts through the Department of Public Health. One of the things that I have asked Iowans since the start is to remain calm and to be informed. The term shelter in place does not mean that any state's orders are different from or stronger than what we are doing in Iowa. What matters is the substance and the order, not its name. We are in this together, so I'm asking every Iowan be informed about this issue, including the media. We all have a responsibility responsibility and a role to play. You have an important responsibility at this time. So please help elevate and amplify the message that we are saying to Iowans, that they need to stay home if it's possible. The best way that we can prevent being exposed and exposing others is by staying at home. Go out only for essential errands and do it one at a time. Practice social distancing of 6 feet or less. Enjoy outdoor activities, but do it responsibly. Work from home if you can, and if you can't, practice good hygiene, disinfecting your area, and again, social distancing when possible, and isolate yourself if you are sick, and stay home 24 hours after you are symptom-free. If we can do this and be responsible, then we will be able to get through this pandemic sooner rather than later. So we are in this together, and if we all do what we need to do and be responsible for our actions, we will accomplish everything that we've set out to accomplish since we first entered into this on March 8th. So with that, we'll go ahead and open it up for questions.
Governor, the Iowa Department of Corrections and several county jails are taking action to try to mitigate the spread of COVID-19 in their facilities, whether it's expediting the release of people. Several groups sent you a letter on March 26th asking for you to do the same for youth in detention facilities and for the Eldora school. Why haven't you done anything about it yet?
Well, I'm not aware of a letter, so I would have to check with the team and see what that is. And again, as we take a look and continue to evaluate and work with our various agencies and departments, they've done a really good job, I believe, in being proactive and putting the practices in place to help mitigate the spread and again, flatten the curve. And so I know that Director Skinner has done a great job of addressing many of those issues, as well as our judicial system. And I know that the director for the Department of Human Services also has put many, many mitigation efforts in place. So if you want to get a hold of my team, we can follow up with you. I have not seen the letter yet, so we'll take a look at that. And just maybe, sometimes it truly is just a misinformation or a communication issue, so we can walk through what we've done and talk about what we see happening going forward, and if there's additional steps we need to take, we're always welcome to hear what those suggestions may be, and again, make those decisions based on data and what we need to do to protect all Iowans' health and well-being. So I appreciate the question.
Governor, Iowa's still one of a handful of states that has no shelter in place, and Dr. Fauci says every state at this point should have a shelter in place. So what is your response to him?
Well, I would say that, maybe he doesn't have all of the information again. You can't just look at a map and assume that no action has been taken. That is completely false. I just listed through a list of steps, incremental steps that we have taken since we first found out about the 3 positive cases on March 8th. So I would say to him, does he recognize the fact that we have closed down schools, and we've actually done that through March 30th? Is he aware of the various businesses that have been closed, restaurants and bars, through April 30th, that we have implemented no social gatherings of more than 10 people, that we have added additional closures to the orders that I have put in place based on data and metrics that we daily look at and move forward. So, at the same time, too, you have Dr. Birx that is also saying to Americans, we need to look at ways and metrics that we can use to open things back up and, be ready to, based again on metrics, what do we look at if we see we see a downplay in the number of hospitals, the number of positives, the reduction in deaths. I don't know what those metrics are, so we're working. I mean, we have them, but I don't have the list. It's sort of similar, but we're working on those simultaneously. So we also have to be thinking about how eventually we'll be able to open things back up. So they're kind of sending both messages. They're just saying in a different way. And I would ask that, you take a look at what each individual state has done based on the data in their state to address, to bend the curve, flatten the curve, protect the health and well-being of Iowans while making sure that we're not overwhelming our health care systems.
Last question in the room.
Governor,
Go ahead.
You said you've been working with the Iowa Department of Public Health, and been taking their recommendations. Are there any recommendations that they've made or asked you to do that you've rejected so far?
No. They are the experts, and so I can't think of any. So we literally meet in the morning and we meet in the evening. We're co-located out here at the SEOC. We work very closely throughout the day, practicing social distancing, but really looking and reviewing the information that's coming in. We work closely with the regions that Sarah was talking about. I mean, we have local public health officials and emergency managers and teams that are on the ground. We have LNOs through the Iowa National Guard that are helping facilitate and really collect the information and data that we need region-wise so that we can make sure that if we start to see a potential uptick or a surge or a hot spot, that we have the availability of beds, we have the availability of equipment, we have the availability of workforce, ventilators, and so, it's a very collaboratively addressed, and I've appreciated the direction, the guidance, and the recommendations that they have provided to me.
KCRG, go ahead.
Hello, Governor Christopher Earl. On this Friday, I appreciate your time. With a question on education, and we had this yesterday with it getting pulled back to April 30th. Is there a date, whether it's May 4th, May 11th, where you're going to have to get school in session for the spring semester to really complete this? Anything you can share right now for maybe a target date?
To when we would open things back up? Is that what you're asking me?
Is there a point where we reach like May 11th?
Oh. Yeah, so I jumped on a conference call after the press conference yesterday with Director Lebo and superintendents and educators from across the state, and there were a lot of people on the call. And I think one of the things that they've asked from me and we've tried to do is just to give them at least a 2 weeks notice if possible. And so we're reevaluating the numbers on a daily basis and then on a weekly basis as well. So I made the pledge to them that I would continue to do that, and we would reevaluate within the 2 weeks, see where we're at, and again within the next week, so that they have plenty of notice on what we believe is the right thing to do for the next step. But right now, we're gonna hold out hope, and hopefully the mitigation practices that we put in place will flatten the curve, and we'll start to hopefully get things opened up sooner rather than later. We haven't peaked yet, so we're not where we need to be, but we'll continue to make those decisions based on data.
Barbara, go ahead.
Governor, I have two questions. The Iowa Board of Medicine, a group of Iowa medical professionals, wants you to issue a stay-at-home order despite what you described as those incremental steps and your belief that it's enough. The head of the board said, I think as the situation worsens, the board would like her to consider going one step further. So they are considering the points that you've made. So I'm curious why the board is wrong. And then second, your staff told lawmakers that additional projections will be available next week for Iowans to take a look at in terms of cases and other information. So what will that data show exactly?
I have not received the letter yet from the Board of Medicine. I understood that they took a vote, and we always want to hear from medical professionals, and I'm interested in reading the letter and seeing what their recommendations are. I would love to have maybe representation from the board, either get on a phone call with Dr. Padati and our group and walk through again what we've done and what they think that we need to do that's outside of the steps that we've already taken. There is still some disconnect on what we've done and what the expectations are and actually what's taking place in other states across this country. So, they haven't shut down business. They haven't shut down their entire states. They are keeping open essential business. People are allowed to go outside of their home for groceries and medical visits and exercise if they do it responsible. So I am always interested in getting and hearing the feedback of the medical community. But again, I would like to have them walk through with our team what we're already doing and what they see or think that maybe we should take a look at outside of the metrics that we're already using to make the decisions that we're making. If they're I think Dr. Padati can address this, but the things that we're looking at are changing all of the time. And so I think that's one of the things that we've said. It's not stagnant, right? As we learn more, that goes into some of what we're looking at. But I'll let you.
Yeah. No, thank you for the question, Barbara. And I think we're all really saying the same thing, right? We've all collectively recognized that this is a new virus, that it's an unprecedented situation, and that we're all working together to protect as many people as we possibly can, keep all Iowans as healthy as possible, and really focus on the people who we know are at highest risk for higher consequences of this virus. So again, focusing our efforts on protecting our most vulnerable populations and making sure that we support our healthcare workforce as best we can. And so I think, those are all the same goals that we share and that we continue to work on. And I think, as you heard Governor Reynolds say, part of the strength of a response like this, comes from being flexible. And we continue to be flexible. We continue to want to hear what's going on. Again, we have a variety of partners at the local, state, area, states, regional, national, and even global level that we look to help stay in touch and adjust as needed. And we're going to continue to do that. This is going to continue to be a response that we're going to have to be flexible on and continue to work together on. And so it's a really important thing. And those conversations that you are mentioning, whether it's with the Board of Medicine or anybody else, are things that we're absolutely going to continue to do. And in terms of additional information, again, as we learn more and as we have more experience, again, with a virus that was identified in December of 2019, we do have more that we'll be able to share. And so every day we're looking at ways to provide more information to help us understand how we can best serve Iowa, and also to help share that information as quickly and efficiently as possible with all of you. So we will continue to do that.
Rachel Drozy, We Are Iowa, go ahead.
Hi, Governor.
Hi.
So we are getting a lot of questions on what happens if we do get to the point of a statewide shelter order. So a few things that we are getting questions about are, will people be cited if they are out? Do essential workers need to carry letters from their employers? And also you referenced Minnesota having 78% of their workforce classified as essential. Do we have a breakdown of what percentage of Iowa's workforce would be considered essential?
Well, yeah, it's close to that. It's probably like 80 to 81% when you think of the food production that we have going on in the state, our role in feeding and fueling the world. When you look at our high manufacturing base, our high financial and insurance base, our state workforce that is out there daily taking care of Iowans in every single corner of the state. So that's some of the issues that you have to deal with when you're making this decision. And that's why I appreciate Dr. Padotti and the team, and really the Department of Public Health, providing us the information, and we can get granular or we can build it out. So we can look at communities, we can look at long-term care facilities, we can look at regions, we can look at counties based on the metrics that they are giving us, and then we can, they're hands-on with them with their local public health personnel, so that they're asking the questions. Are we getting the message out? Are we not practicing social distancing? Are they gathering in groups of 10? Do we need to take additional steps in that area to really protect the well-being of some of our most vulnerable Iowans? And you can look at that from a community, a county, or a regional perspective and see where we need to dial things up, or the opposite is true as well. As we see this move across the state, the numbers are a little bit higher on the eastern side of the state. At some point, we might see those stabilize and start to go down, and maybe we can start opening up that area of the state. And that's one of the reasons I appreciate the flexibility and really basing the decisions on data that we're looking at, so that we can dial up, dial down, and really be strategic in how we're applying these orders. Because right now, I have ordered that you can't gather in groups socially larger than 10, and that is a simple misdemeanor. So, I mean, there are already some, punitive measures in place for doing it. So, those are some of the questions that we walk through when we talk about what does that next step look like.
Kay Henderson, Radio Iowa. We'll come back to you. David Pitt with the Associated Press.
Yes, Governor, thank you. Question on the shelter in place. So I don't believe, would you talk much about what the negative effects of something like that would be? So, What are the fears, or what's the downside?
Yeah.
in implementing that step?
Well, actually, that's why we had Director Claybaugh in the other day. I mean, you have to talk about, mental well-being, not just physical, but mental well-being. We are a connected community. We work. I mean, there's just that side of it as well. In addition to, suicides and domestic abuse. I mean, there are a lot of downsides to it as well. Is there anything else that I need to add to that?
No, I think that's pretty much.
But, so we want to make sure that we're providing, that's one of the reasons we've asked for additional help through the disaster declaration at the federal level so that we can stand up some help for mental well-being, because we know that this has a significant impact on Iowans when we've asked them to really be responsible and stay home as much as possible. If you can work from home, work from home. If you can not take your kids to daycare and you can keep them at home, do that. Well, all of that takes a toll on everyone. We love our families, but at some point it's hard. And so all of these decisions can have underlying effects on Iowans. And so we have to also be able to manage that. That's why we encourage people to get outdoors, get in your car and go for a drive. Just don't gather, but you can go for a walk, just practice social distancing, go to a park, just stay off of the playground equipment. Take advantage of these nice days in spring and get out there and get some exercise and take care of yourself.
Chris at KCCI.
Hey there, Governor. So we've been hearing about states needing for ventilators. What's been the process like that to you? And what are you hearing on some of the calls with others?
Well, we've not made it a secret that throughout all of this, PPE has been a concern, personal protective equipment, and we're just not where we need to be. So the longer that we can kind of flatten the curve and allow the states and the country to ramp up when it comes to creating or building ventilators and masks and shields and gowns, we have so much positive things happening in our state when it comes to businesses retrofitting Department of Corrections, whether it's distilleries doing hand sanitizer or the Department of Corrections making gowns and face shields and hand sanitizer, to businesses. I listed several the other day that are cranking out face shields. We've been able to gather the information from all of the hospitals, and right now between vents and the anesthesia machines and being able to convert those, we've got about 1,751 available, and so it's not, we know where they're at, and again, as we monitor and look at the metrics, we know where they potentially need to be or how we can move them or move patients to where they need to go as well. And that's being done through the 6 RMCC regional medical coordination centers. They're getting that data every day and working with the teams on the ground in the hospitals within the region, and really making sure that we have the most up-to-date information to take care of Iowans.
All right, last question. Kay, if you're on the line, otherwise we're going to wrap up. Thanks, everyone.
Thank you.